Hey everyone, I'm Dr. Psychologist Psychiatrist. I am a practicing dermatologist at Mahi Clinic, and today I'm here with very dear Dr. Ansha Patel, a mental health specialist, and we will be talking about depression and skin, and depression and suicide. So, Dr. Ansha, thank you for being here. Thank you for giving me a valuable time. Thank you for calling me.
Oh, Dr. Swati.
So, let's start with what exactly is depression? How do you define it?
Depressive disorders, clinically, what we understand, are persistent pervasive sadness, anhedonia, anergia.
एनीडोमिया मतलब आपकी जो चीजें जिससे आपको खुशी मिलती थी अब उनसे आपको खुशी नहीं,
लॉस ऑफ प्लेजर, आपकी रुचि नहीं रहती है।
एनर्जिया इज बेसिकली लॉस ऑफ एनर्जी, लेथार्जी रहते हैं, सोते रहते हैं, दे डोंट वांट टू गो टू वर्क, बिस्तर से उठने में प्रॉब्लम, राइट?
And this should be pervasive persistent for at least 2 weeks minimum. उससे ज्यादा भी हो सकता है, but ज्यादातर टाइम at least 2 हफ्ते का जो ड्यूरेशन है वो मिलना चाहिए. This is one part of the clinical syndrome. The second part is when we look at for other symptoms in which there is lapses in attention, lapses in memory, decisional vacillations, मतलब कोई भी काम करने से पहले कई सारे डाउट्स आना, डिसीजंस लेने में डिफिकल्टी होना. You can have loss of appetite, there can be loss of weight over the past 1 month, you can have sleep disturbances which can be categorized in several ways. And इसके अलावा self care can be compromised, social involvement can be reduced.
Self care compromise means they don't take a bath for weeks on the end.
They will not be interested in grooming.
Yeah,
they will not be
karna वगैरह.
Right. They will not be interested in looking at themselves in the mirror. They will not be interested in dressing. They will not be matching their dresses. They will not be changing clothes. General personal hygiene will not be maintained in a lot of conditions.
You'll be like, dude, you're smelling, and they'll be like, no, I don't care. I just don't care anymore. Okay.
So there will be loss of self-care. There will be other symptoms such as pessimism, low self-worth, helplessness, hopelessness, suicidal ideations, death wishes, even guilt feelings. So these are the common ones that you get to see. And then clinically several other things are ascertained and checked. So there can be somatic symptoms, there can be psychotic symptoms, there can be atypical symptoms. Variations can be there in terms of prognosis, age, congruence of the symptoms. So that's the clinical aspect.
Psychosomatics.
Yes. Psychosomatics, for instance, if you look at dermatology, one thing which is very closely associated to self-care will be worsening of itching, even skin hygiene se associated deterioration in people. Also, people will complain because there will be a lot of insomnia-related symptoms. So, रात को नींद नहीं आती है और रात को itch और भी ज़्यादा खराब हो जाती है.
Absolutely, yeah.
So, the itch threshold will lower. The pain sensitivity will increase. And the ongoing pattern of a particular activity, like sometimes we also have obsessive symptoms in overlapping with depressive syndromes. So, rigorous scratching can be there.
You'll be like, इतनी ज़्यादा खुजली होती है रात को सोने जाता है.
Exactly.
And usually ऐसे patients जो मेरे पास आते हैं, ऐसा नहीं है कि सबके, कुछ लोगों का ऐसा नहीं होता है कि सब दिमाग में है. But हाँ, like हम reports कराते हैं, usage count वगैरह कराते हैं. And you know, in some patients it is high. Generally उन्हें problem है, but कुछ patients में definitely अगर साथ-साथ mental health का भी issue है, if they are depressed, then they also have this problem. They'll just keep on scratching, and they also develop rashes.
Yes.
And कई सारे लोगों की दर्द होता है उसमें. कई सारे लोग तो इतना ज़्यादा scratch करते हैं वो खून निकालते हैं.
Exactly.
So definitely. And I'm not talking about old people. जो 70 plus, so जिनकी skin already बहुत thin हो जाती है because of age. So yeah, definitely वो scratch करके bleeding spots हो जाते हैं, which is quite common. But yeah, people do complain of generalized pruritus और वो कहते हैं रात भर खुजाते रहते हैं.
Exactly. Worsening at night.
Yeah.
It's quite sensitive. particularly when they are not able to sleep, it will worsen.
We had a saying, जब भी हमें कोई बोलता था कि हम इतनी खुशबू होती थी हम रात को सो नहीं पाते थे, जिस तरह कि आप दिन भर काम करते रहते हो, so your mind is occupied, but at night when you are just with yourself, you have nowhere to escape, तब आप किसी एक चीज पे focus करने लग जाते. Is that true? Like
It's true. It's sort of they can't detangle out of it.
they cannot be.
So the itch perception and the threshold sensory perception is all interrelated.
Okay.
Okay? And they get into all these behaviors. Why are they repeated? Because they're relieving. You tell a person to stop it, they won't be able to, because they have that urge to do it again and again, so that they're relieved with the anxiety or the worry of the particular phenomena happening again.
Basically, it leads to the release of endorphins, that is happy hormones. The scratching releases that, and then you scratch it, you are a little bit endorphins or happy hormones are released, and you are like relieved. फिर उसके वापस से स्टार्ट होता है, then वापस you scratch.
The cycle will restart.
ये cycle पूरा आपका चलता ही रहता है till you stop it with medication. But patients with a chronic condition के साथ आते हैं, हम obviously as dermatologists we do give them medications. ऐसा नहीं है कि we go ahead सबको मैंने बात किया, मतलब हम बोलते हैं कि ठीक है. So we do like treat So we do treat it with the medications as doctors, because we do empathize with them. That's horrible. Like imagine आप बैठ करके बस अपने आप को खुजाया जाता है. That's terrible. Like I can't even imagine कि आप सो नहीं पा रहे. And but how do you approach it psychologically? The psychologist, suppose if I refer to your patient with this problem, 15-20 years, they are just scratching a lot and they have these skin rashes. It's quite terrible. And frankly, उन्हें relief नहीं हो रहा है. मैं उनको दुनिया भर की medicines दे चुकी हूँ already.
Right.
So how do you approach these cases?
Right. See, there are multiple pathways of approaching. The first thing which I would usually do is I'll take a detailed psychological evaluation, screen them for any comorbid psychological disorders, psychiatric disorders, etc. That's the first thing. The second is a psychological assessment, in which profile of personality is usually done. So I get to know the background of this person in and out, because I'll be planning therapy sessions which are often dovetailed to their personality profile, and I also get to know the tolerance of the person to a lot of cognitive and behavioral techniques which will be used.
I'll have to interrupt you on what exactly is a personality test? Is it like one of those internet wala quizzes of like kya personality hai? Like there's like a Myers-Briggs test and there are lots of tests. Like what is a
Myers-Briggs is mostly used in organizations at times.
Okay, because I took that test and I was like, oh my god, I'm this INT or something type. I don't remember. I was very happy about it. But somebody then told me, one of my friends, like, it's not accurate, you know that, right? It's a bit disheartening. What personality test do you use? Like, it has to be specific, it has to be like very purpose, certified. It's not one of those internet types.
See, there is a different branch of psychology, which is psychometrics, which is dedicated to making tests, standardizing them, validating them, developing norms, reliability, validity, cutoff score, sensitivity, specificity, etc. So that's a different branch altogether.
So people
it takes at least a minimum of 3 to 4 years to devise a test and standardize it in different age groups.
So if I want a personality test from you, it's not going to take 3 years, right?
I already have something which is an end product.
Okay, sure.
And we'll do it on you and we'll get to know more of you. Not that I won't if I talk to you.
Okay. Alright, so there you have it. It's not an internet thing. अगर आपको एक psychologist बोलते हैं and it's going for a personality test for diagnosis, तो आप ये नहीं कह सकते हैं कि पागल है मैं जा रहा हूँ मैं इंटरनेट पे कर रहा हूँ वहाँ पे है ना फ्री में हो रहा है. So these are very different things. Psychologist has a certified test where they have worked very hard and it's very person specific also. Okay, so please don't compare the internet test with your test, yeah. Which I think you must be coming across people who must be doing that. मैं इंटरनेट से कर लूँ क्या? फिर इंटरनेट पे free.
Actually, I haven't faced so much so far.
Okay. No, I would have gone like when in my icebreak here. No, you would have.
Yeah, the one which is freely available, which is
you would
a
have
fake
gone,
version of the original one.
Yeah, you would have gone like
because the original one would be very
Freud. Yeah, I know. Freud test would have been like maybe you felt something for your father or mother. Freud के तो test यही होता है. उनकी theories तो यही रहती थी. बचपन में कुछ trauma हुआ होगा, अब वो बाहर आ रहा है. Anyways, so we are significantly deviated from the topic, and so you're
talking about the management.
Yes, of course. How do you approach these cases?
Right. So we do a detailed evaluation. The next thing we do an assessment, which can have a couple of tests taken together or a single test taken. The next is we devise a psychotherapy management plan, which can start off with behavior interventions, behavior modification programs. It can start off with cognitive therapy directly. It can deviate to something which is a mind and body technique, which can be something like hypnosis.
Okay.
It can again go off to techniques such as biofeedback, but these are the standalone techniques which have been pretty much established in dealing with psychohypnosis disorders.
Is like not with some witchcraft. Hypnosis is something which is proven, which is done in patients.
Yes.
Not like movies में नहीं होता है कि वो chicken बन गया, वो बकरा बन गया, something. No, it is like a proven thing which psychologists do, and it helps people. Yeah. So there you have it. Hypnosis is something which is done. Okay, it's not psychological. It's not a bull. It's not bullshit. Right? It happens. It is done. Yeah. Because I watch movies and I see like Ting Ting or आप जा रहे हैं. There were like a few shows also ना जिसमें वो बताने लगते थे कि वो पिछले जन्म में क्या थे. वो hypnosis से आपको पिछले जन्म में ले जा रहे हैं और all that nonsense was happening. So they basically, that's not it. Hypnosis which you do is,
This is clinical hypnosis.
Clinical
what
hypnosis.
I do is integrated as a part of cognitive behavior.
Okay. So this helps people.
Definitely
it does. So how many sessions are basically required?
See, it is a very customized sort of a situation, and hypnosis is not something which one can do for anybody and everybody.
Okay.
A very selected few will be eligible for hypnosis.
Alright. How many sessions of hypnosis?
It's a very customized sort of a thing, and one has to first decide the suitability of a person for any kind of an intervention, and then we plan the intervention.
Okay.
So there are thousands of techniques which are available in CBT, CT, different generations of techniques also, and there is extensive training undergone in that because it's a treatment module.
Yeah.
And then is when we decide a person and mix and match the technique to the person.
That is actually quite enticing, hypnosis. That the mention of it is enticing.
Yeah,
I'm just curious about it. That you just basically remodel a person's subconscious. Is that how it works? You basically remodel it over many sessions and you help them out. Yeah. So, in my dermatological practice, I have seen people with depression जो mainly hair fall की complaints के साथ होता है. तो obviously medically we manage them in the best way possible that we can. And basically इनका अगर hair fall भी इतना होता है it's because of the loss of acne. And so you also, patients with depressions are also approached in such a way. Like how do you approach them? Do you engage in CBT? Like if अगर हम medical management पे नहीं जाए mental health issue पे and just psychological counseling is with that. So there are counseling sessions, and what else can you engage in these people? Because if there's anyone out there with depression,
see, I tell you, self-help. That's what you want to ask.
Yes, absolutely.
Okay. Yeah. So in terms of self-help, self-care is very important.
Okay.
Regulation of circadian rhythms is very important, which is eating, sleeping, exercising, or even like social interactions. Regulation of those particular things are quite important in depressive illnesses.
Okay.
And that sort of works for people who are having subclinical features and who are not really morbid. See, there are two things to this particular phenomena over here. One is to have the internal resources of dealing with this particular problem on my own. Then I read up something, ask someone, take somebody's advice, and then sort of implement it.
Yeah.
The second leg is when I do not have the internal resources, and my social resources and familial resources are also not able to help me come out of a condition. Then I opt for professional support.
Alright. So that's how.
Where a structured sort of an intervention is usually taken.
So that is like in whole the management.
Correct. True.
Yes. True. Alright. And obviously there's no prevention of depression. Like how do you tell
people? It is a preventable condition.
It is a preventable condition. Like, how do you, can you please elaborate on that? How can you prevent depression?
Like I just mentioned, see,
circadian rhythm to maintain that.
Yes, one thing is self-care. The second is circadian rhythm. Thirdly, the third thing is if you anticipate a particular event it's going to be difficult.
They say for students who are going to be
yes. So if you already know it's going to be difficult, then psychological preparation is very important.
And what do you mean by that?
For instance, if you're dealing with academics, then what part of academic? Is it academic skill which is deficient? Is it the anxiety part? Is it the familial part? Is it the over expectation part? Is it the attitude part? Is it the belief system of a person where there is an outcome and your expectations, there is a gap between those things. So one has to sort of fine tune this is me and that is where I want to be. And one has to keep reaccommodating to those things in a way that it is adaptive. So each mental health condition is preventable.
So you don't have to be like this is absolute.
There is psychological realities are not absolute. Not like physical realities.
So students who are preparing for NEET or any other competitive examination, it doesn't have to be absolute.
No.
They shouldn't be this is absolute if this does not happen. So अगर ये सोचते रहेंगे, usually in coaching institutes that is encouraged. You know कि यही है, यही करना है, यही रास्ता है. You know, and be a winner, be a this, be a that, or किसी का फलाने चंद का ये उसमें हो गया है something, तो उसका example देते रहेंगे. Students kind of feel that pressure. And somehow the coaching institutes में if you're away from your family, just passion cultivate करते हैं बच्चों को, which is good to an extent. But कई बार I think they make it absolute. इसके beyond है ही नहीं, आप इसके ऊपर ही focus रखो, एक ही goal. What do you and धीरे-धीरे करके those students they fall into a depressive state because they start realizing maybe they are not as good as other people. Maybe they are not in top 10. अगर जैसे कि कोई बोलते हैं तो अगर आप top 10 में नहीं हो तो हो गया बस you cannot get in any college. So what do you advise these students exactly? Like how do you like know you're depressed and you know how do you sort of not make it absolute? Okay, that's not exactly a good question, but like how do you what do you advise these students? What advice would you give these students?
See, there is no shorthand magic rule that follows for everyone. I just suggest a person who is upset to come and talk about it. So that we can explore what's happening.
Absolutely. It's not absolute. Like contrary to what people are telling you,
there is no magic mantra to all these things.
If you feel like it's not for you, you badly want to be a doctor or you badly want to go to IIT, but somewhere along the way, if you realize that this is not for you, this is not happening, so we should basically encourage them to talk to someone and know that there are other options in life. That nothing in life is absolute. It's not worth your mental health. It's not worth your life in the end of it, right? So definitely encourage them to consult a mental health specialist also, because not only do you help them out in a way, you also help them to determine a better way of living their lives.
Correct.
Absolutely. So thank you, Dr. Ansha, for being here and letting me eat up your mind for a while. Thank you so much for being here and answering my KY questions. Thank you so much.
Thank you so much.